Ketamine has exploded into the world of psychiatry. Its use has recently been recognized as a game changer in the potential to treat difficult cases of depression, anxiety, mood disorders, PTSD, and chronic pain conditions. Ketamine was first FDA approved in 1970. It was developed as a follow-up agent for PCP from the late 1950s. It was recognized that ketamine provided a dissociative anesthetic quality to it when it was used, meaning that the person would effectively be awake but yet not able to feel any pain. In other words, their lights were on but nobody was home. This enabled the use of medical procedures and surgical procedures on individuals with safe dosing of ketamine to actually have procedures performed without deep types of anesthetic monitoring. In fact, ketamine was used throughout the Vietnam War as a method of extracting patients in a safe fashion. Ketamine provides a cardiovascular stability to individuals when it's used, meaning that it can be injected at high doses and yet people will be able to maintain their respirations, their oxygen saturation, and respiratory reflexes as well as blood pressure. This allows ketamine to be used out in the field without much monitoring. And in fact, in 1985, the World Health Organization placed ketamine on its essential medication list for all countries throughout the world simply because of the efficacy and safety of ketamine in terms of anesthetic use. In 2019, ketamine was FDA approved as Spravato, as a nasal spray for the treatment of depression and also suicidality. Ketamine was more recently utilized in the intravenous formulation as well as oral and intranasal formulations in a racemic mixture for mood disorders and depression. As many people are aware, there are lots of antidepressants available over the past 50 years, and many of these antidepressants have failed in terms of their ability to treat depression. The first antidepressants at best have had maybe 30% efficacy in depression treatment, meaning that the first trial of medications would only affect about 30% of people after about 2 months of use, and the other 70% would have less effect. Ketamine has represented a new approach to the treatment of depression as it affects a totally different system inside the brain, in particular the glutamate system. The glutamate system represents about 60% of the neurotransmitter load in our cerebral cortex, and glutamate is a neurotransmitter of learning. It is involved in the actual formation of dendrites, which is part of neuroplasticity, a part of the brain that is growing all throughout our lives as we learn about things and unlearn about things. Ketamine comes in a number of different formulations. In general, in ketamine clinics, we will utilize Spravato as a FDA-approved version of ketamine, or intravenous ketamine, which is much more rapidly effective and through recent meta-analysis also is more effective than Spravato nasal spray. Ketamine also can be injected intramuscularly. It can be taken as an oral troche, which is a lozenge that's placed under the tongue, and it can be swallowed as well. And there are several other methods of injection and utilization of ketamine, but the most effective with the most consistent blood levels is intravenous ketamine. Intravenous ketamine requires the placement of a small gauge IV catheter. It is done in the office setting in a comfortable and safe monitored situation. Individuals generally will sit on a reclining type of a couch or a general recliner. They will be monitored with pulse ox and blood pressure monitoring as needed, and a drip is initiated over the course of about 40 to 45 minutes based on an individual's weight. The dosing of the medication generally starts at 0.5 milligrams per kilogram based on ideal body weight, and through the sequence of infusions over the course of a few weeks, this dose will be escalated in a sequential fashion as the patient tolerates it, up to about 1 milligram per kilogram over 40 minutes. For the treatment of depression, most individuals will receive 2 or 3 infusions per week for a total of 6 infusions. These infusions are, again, about 40 to 45 minutes in length, and the main side effect is nausea and some vomiting occasionally, as well as the trippiness, which is basically individuals will describe a situation in which they feel dissociated somewhat, or they notice enhancement of colors and sounds and textures, as well as other types of sensory abnormalities that resolve immediately at the end of an infusion. An infusion can be stopped at any point in time, and the individual will return to their normal state within minutes. However, balance can be off for a few hours, which is one of the reasons why a person can't drive to and from an infusion process. Otherwise, most people are perfectly fine to work the next day. In fact, many people will work the same day and come in and get their infusions. And the main side effect of the treatment itself is that 70% of patients will improve in terms of their depression or mood disorder over the course of those series of infusions. Usually, by about the third or fourth infusion, most patients will start to notice significant differences in the way that they feel. Now, what is interesting about ketamine is its ability to improve wellness parameters as well as just the basic parameters of depression. And as you may know, most people with depression may feel sad, or they may feel that they have a loss of interest in the basic things in life. They get very emotional. But the other side of depression includes cognitive loss and brain fog, difficulty making decisions and having insight and executive functioning, as well as problems with motivation. Individuals just don't feel rewarded from the basic things in life. They just don't feel excited about the next great adventure. And fatigue is also a significant problem. Now, the majority of traditional antidepressants don't actually treat the wellness side of depression. The depression experience includes all of these problems. Ketamine has been shown to help a number of different aspects of depression, including wellness factors such as decreasing ruminations, improving self-esteem, and also decreasing the hamster wheel type psychology of negative self-talk and self-sabotaging type behaviors. Individuals given ketamine infusions feel more hope, they feel more motivated, and they feel less fatigue, as well as a lifting of the brain fog that frequently accommodates depression type problems. So ketamine, through a series of infusions administered over the course of 2 weeks, has been shown to improve or actually cause remission in over 70% of treatment-resistant depression patients. These are individuals who have failed multiple types of modalities, multiple medications, ECT, TMS, and other types of interventions.